Hello, we're talking about treatment planning cases, especially treatment planning complex restorative cases. Remember, everything that I'm talking about is comprehensive dentistry. What is comprehensive dentistry? The objective is to restore the dentition and supporting structures to optimum or desired health, function, comfort, and aesthetics. Or desired means there may be a case that is a semi-train wreck, but the patient can't afford, or for some reason can't do the whole case at one time. You may have to break it down into parts. Sometimes you can and sometimes you can't, but if you can, you may begin with the desired restoration, with the patient understanding it's not going to be perfect from the get-go, it's just going to be a lot better. So it's not just about the patient, it's also about you. That's what I tell patients. This is about you, but it's more about me, because I don't want anybody walking around out there with something I've done that doesn't work. I want the restorations that I place on teeth to be functional, aesthetic, comfortable, and hold up. Think different, be brave, bend a few rules. What that means is do it the way it has to be done. You don't want to harm anyone, but you don't have to do it the way it's always been done. If it works better another way and it's not going to hurt somebody and it gets the job done in a better way in your opinion, be different. Do it that way. So our objective must always be to perform those services for each patient appropriate to their temperament, circumstances, and objectives. That's what's on my mind. What does this patient want? I'll talk a little more about that when we get to the interview here in a minute. So I can't practice without these two books, the Dental Diagnosis and Aesthetic Restorative Dentistry picture books, and I couldn't practice dentistry without my camera system. Visual is the key. I want to show patients what pathology looks like, and then I want to show them what their teeth look like, with the objective being the patient can diagnose themselves. This woman, she thinks there's no hope. She was a pretty sophisticated woman, just life got in the way, and she quit taking care of herself, got depressed, and they all say, I know there's probably nothing you can do. And I say, there's always something I can do. I can fix anything. You've got a few teeth, but you want to look at it globally and say, is there enough there to do something with? Don't just fix a toothache. Think to the end and work backward. Say, where is this going? Where is this going to end? And be sure that the patient understands, where is it going? And I want to hear from them. Where is this going? Is this all the money you have to spend on this right now? Is this a priority with you? Are you just looking to get out of pain? If you're just looking to get out of pain, you probably don't want me. You probably want to go to somebody that just does toothaches. And I support those practices, by the way. It's just not what I want to do. So when they see this and they've got a really bad situation, it gives them hope. What is a complex case? See, with a complex case, it doesn't mean you're doing something to every tooth. It just means you're analyzing it like you were analyzing a house to remodel, or you were analyzing that car before you drove it to California or Alaska. And I'll say to people, what part of the car do you want to fix? All of it. You want everything to work. And so you've got the functional part and you've got the cosmetic part. And that's where the interview comes in. So a complex case may just be somebody wanting to save their teeth for function, or they may want function and cosmetics. How do you read an MRI? I've probably got the most extensive TMJ MRI collection in the world.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.